Hi, this is Dr. Randy Grill, nursing home dentist, and today I'd like to talk about how to get a second opinion or how to be wise in getting a second opinion for POAs. You could be a DON that has a trust patient under you that you care for, or anybody with authority, even family members to advise the POA. If you do have the power of attorney, these are some things that I really recommend you do. First of all, call the doctor. In other words, call the number. It's all over my records. You can ask the nursing home for our numbers, but call. Talk to Pam, my wife. Find out the out of network benefit so that you can take advantage of our good policy. If you're with our other doctor or my partner, you call his number. Don't call the business office. They're not going to actually understand what you're wanting. They may email us and take a couple days, so just call Pam. And the number is on our record on the right-hand side. You can call the nurse. They can get it for you right away on any of our records. Second, find a dentist that treats nursing home patients or has. Oklahoma has great dentists. I respect the dental school. I respect the dentist. I've practiced in several states. They're some of the best. But the thing is that you need to ask questions are, do you treat nursing home patients? Most of their patients that come in the dental office, an 80-year-old or a 90-year-old that lives at home or lives with their kids at home is not the same person as one that has a two-inch thick record and needs full-time nursing care. So it's your responsibility to find a dentist that is familiar with the system and how to do that. And here's some questions that you need to ask them. Ask them, have they ever treated a patient with DNR? If your mom or dad are not a full code and they are DNR, the dentist needs to know that. He may not know how to handle that, and it is important in his diagnosis and treatment plan that he understands he doesn't have the tools of 911 or his Ambu bag or his oxygen or CPR to revive your loved one if something goes traumatic. We can't be as brave as we can on full code people. So have they treated DNRs? Are they willing to treat DNRs? In my practice, in the Air Force and in private practice from 1976 to 1999, and I thought I was a big dog in dentistry, I don't think I treated one DNR patient. And if somebody, maybe one or two people actually were brought in from a nursing home, it was way too scary for me. So I would refer those on to the oral surgeon who would do surgery. And that's what you need to know, because the papers that the nursing home copies often send may or may not have the DNR on it, may or may have their weight or other important information. I had one person I went in to remove an easy tooth on, read through their records, went into the room, and then inadvertently talking to his staff 2 weeks before, the son had picked up his mother, broken both legs, and they told me she was bedfast, but the covers were covering up her legs, and I'm not going to pull down covers to see if their bones are all healthy. And that record, that incident, hadn't made it into the charts yet. So reviewing the chart is critically important, and that's the next question I have is, ask if they will go to the nursing home, talk to the daytime charge nurse between 7 and 3, because they know the most about your mom or dad. And I say mom because 90% of my patients are female in long-term nursing care. See if they'll go through the record. They'll find things that in talking and in being part of the team that they may have missed. That's critical information. How she eats, does she eat a feeder table, different things like that. The next question to ask the dentist of your second opinion is, what is the average stay of a nursing home person in long-term care till they decease or till death? University of San Francisco says it's 1.3 years national average. I know for a fact in Arizona, my dad was there 6 weeks, and they told me there that the average stay in a nursing home in Arizona is 6 months. And the reason for that is mom and dad had gourmet wheels brought to them for $7, and it fed both of them in Sun City, Arizona. The bankers came to the house. Everything came to the house. The fire department was friendly. They had volunteer sheriff's department that came by and checked on everybody every day to make sure they were up. Just different things like that that don't happen in Oklahoma and Kansas because we're not retirement communities like that. So it's important for the dentist to know in my practice, because both my mom and dad had nursing home stays less than 3 months. I wouldn't have gotten them on my panel of patients. So we unofficially think our patients are with us 3 to 4 years. We lose 25% of our patients a year, 20% of them to death, and 5% because they transferred homes, they went back home, they went to skilled, different reasons like that. So even though we lose 25% of our patients a year, our best count is we lose about 20% of them, which would make a 4-year stay, which is much longer than the national average. But that's because I think I get some of the healthier that go into there, and they come in at a McLaren's 2 to 3 and usually leave at a McLaren's 4. There's a video on McLaren's category that you must know, and that's the next thing. Does your dentist know the McLaren's category? And the reason why, in dental practice, I never treated a McLaren's 3 patient, and it's a category that alerts the dentist to the success of his treatment and certain things to do. You can look up, I've got an article right here, oral health for older adults, and then just put McLaren's, McLaran. A dentist, if your dentist can treat him, send him to this video. All they need to do is know the category. It's a paradigm shift. It'll shift their thinking so that your loved one is safer. It's not a big deal. It's just a tool the dental schools don't teach right now because we've only been going in to dental schools and into nursing homes since 98. I've been doing this since 99. So McLaren's is a critical category for general dentists to know. Now the oral surgeons use the ASA PC, which is a category, and you can look that up, ASA space PC. It's the physical physical status of the American anesthesiologist, the American Society of Anesthesiology. There's another quality program. There's different things that the oral surgeons use, so you don't need to ask them this question. They're already geared up for it. But in general practice, the dental schools will start teaching McLaren's if they haven't already, but it's a side course because very few dentists are going to make money on treating elderly patients in private practice. It's so limited and it's so dangerous that they'll do that. So McLaren's, watch the video on McLaren's POAs. This is power of attorney is POA. This is important to you. Do your homework, ask questions. Please get with me so I can explain my notes to you, because when I say non-restorable, there's 1,000 reasons. I'm using the ASA PS standard, the McLaren's, different things like that. These are alerts. They're not necessarily predictors, but they're alerts and they're important to you. Be wise. Do what you feel is right. I've made my decisions for my parents, and one of those decisions ended in the death of my mother. But I'm at peace with that because I made the best decision and I studied. I didn't just give the physician free rein to do everything. I wanted to know things, and now I'm at peace, and that's important. So all I have to offer you is my best skill, care, and judgment. Please call, ask questions, and be safe. Thank you very much. This is Dr. Randy Grill, Nursing Home Dentist.